As at the time of preparing this report, no cases of coronavirus have been detected in South Africa, but the National Institute for Communicable Diseases has put systems in place. However, reports have emerged that Ivory Coast, a West African country, has become the first African country to detect the first person in Africa for coronavirus infection. More on that later. In South Africa, the NICD has put in place systems to rapidly identify cases of the coronavirus in the country. Together with the National Department of Health, the NICD has developed and distributed clinical guidelines and case definitions for doctors and nurses in both the public and the private sectors to better detect, identify, and respond to a possible case. These include guidance on what samples to collect to confirm the diagnosis, as well as how to best manage the case clinically, and to prevent spread to others while the diagnosis is being made. There are several additional resources on standby to enhance optimal response, including placing the Emergency Operations Center in alert mode to be activated should the need arise. Furthermore, South Africa has in place fever screening at ports of entry and guidance documents, including case definitions. Staff at ports have been given information on what to do should a suspected case be identified. The Department of Health has assured the public that measures are in place to detect, manage, and contain any cases of the new coronavirus, should it come to our shores. Port health professionals routinely conduct temperature screening for all international travelers. Fortunately, OR Tambo International Airport is the only port of entry for all flights from Asia. The department says all provinces have activated outbreak response teams and are on high alert to detect and manage cases that may arrive in the country. According to Professor Cheryl Cohen of the NICD, there has been no case in South Africa. In the event that a case is detected, systems are in place to identify and manage the case, to avoid further spread. To assist people who have traveled to China and who have respiratory illness within 14 days of travel, should contact their doctors and share their travel history. Health authorities in Ivory Coast are investigating a suspected case of coronavirus in a female student who arrived from China, officials have said. The student, whom authorities have not named, is the first person to be tested for the virus on the continent. The virus has killed at least 80 people in the mainland Chinese city of Wuhan. The 34-year-old student traveled from Beijing to the international airport in Abidjan, Ivory Coast, on Saturday the 25th of January 2020, and was coughing, sneezing, and experienced difficulty breathing. The student was moved to a safe location upon arrival at the airport, and is currently under medical observation. Residents are urged not to panic, but maintain proper hygiene, and to visit the closest health center in case of fever, cough, or breathing difficulties. More than 2,800 coronavirus cases have been confirmed, prompting countries around the world, including Nigeria, to shore up surveillance and screening at airports, especially for travelers arriving from Wuhan, in China, where the outbreak began in December 2019. Aviation authorities in Nigeria, Africa's most populous nation, said airlines operating in its airspace should update crew members on how to handle sick passengers on board their aircrafts. Pilots must report such cases to health officials on landing, while also encouraging sick travelers to seek help before leaving the airport. Kenya, whose national carrier, Kenya Airways, operates non-stop flights from Nairobi capital to Guangzhou, in China, has also begun screening passengers arriving from China at its airport. The coronavirus invades the lungs and causes them to swell, blocking the flow of oxygen. They are a large group of viruses that are common among animals, according to the U.S. Center for Disease Control and Prevention. In rare cases, coronaviruses are what scientists call zoonotic, meaning they can be transmitted from animals to humans. The viruses can make people sick, usually with a mild to moderate upper respiratory tract illness, similar to a common cold. Symptoms include a runny nose, cough, sore throat, and infected persons may have headaches and, maybe, a fever, which can last for a couple of days. Please check in the description box below for the links to the sources of this report. Thanks for watching. Please comment, like, share and subscribe.